Are you turning 65 or are you going to be new to Medicare in 2025? Are you overwhelmed and confused by all this Medicare jargon that it seems like no one can understand? I've recorded a 30-minute Medicare 101 webinar to help break down the nuts and bolts of Medicare so you, the Medicare beneficiary, can truly understand what Medicare is all about, as well as your plan options for 2025. So get your pen and paper ready, take plenty of notes, and now let's go to the webinar. All right, so welcome to the 2025 educational webinar. Once again, my name is Rob Sevilla with Agape. That's me and my wife and my beautiful family. And I want to encourage you to watch this to the very end because there are 3 Medicare bonuses that I'm going to give you, and I'm going to talk about at the very end of today's presentation. So chances are, if you're watching this today, you're getting ready to go on Medicare, maybe over the next 3-6 months, or maybe you're about a year out, but regardless, you probably have been receiving tons of Medicare mail, everyone telling you about how great their plans are. You should go this direction, or you should go that direction, or maybe you've been getting these annoying Medicare calls and people are calling you from all over the country. It seems like day and night, or maybe you have been bombarded on TV, your local TV station. You've seen all these different commercials from celebrities like George Foreman and Joe Namath, or maybe even as you're scrolling online, you're seeing all of these Medicare ads that are being targeted to you. And that's because you are getting ready to go on webinar. And here's the bottom line. Medicare is very overwhelming and it's very confusing. And so one of my main goals for this webinar is to bring clarity and a better understanding to you. But also, I would love for you to get comfortable with me, the Medicare advisor and presenter today, because I would love to be able to help you on your Medicare journey. And here's the good news. It doesn't cost you anything extra at all to use someone like me who's been in the industry for about 14 years to help someone like you get this right the first time. And I'm going to talk about that towards the end. All right, so let's dive right in today to Original Medicare. Who is eligible for Medicare? Well, according to Medicare's guidelines, you or your spouse must have worked either 40 quarters or 10 years. What are the qualifying events for Medicare? Well, the most popular one today, if you're watching this, is probably you're getting ready to turn 65, or maybe you're on disability Medicare and your 2 years is up and now they've activated your Medicare going on your 25th month. Maybe you've worked past the age of 65. I'm seeing this more frequently nowadays where people are working past the age of 65 and you're coming off of group coverage. Or maybe, unfortunately, you've been diagnosed with end-stage renal disease. So how simple is it to enroll in Medicare? Well, the 2 easiest ways are either to call Social Security or Medicare at the numbers on the screen here, or if you're pretty tech savvy, you can go and you can enroll yourself at the link here. You want to take a screenshot of this, and you definitely want to use your laptop or your regular computer to do this because it can be a little trickier on your phone or your iPad. The good news is if you're already on Social Security, you'll automatically be enrolled into Medicare. If you are not on Social Security currently, when you go Medicare age, then you will have to go and actively enroll yourself. It literally takes about 10 to 15 minutes. One thing that I want you to be made aware of today is your initial enrollment period. This is 3 months before your 65th birth month, the month of, and 3 months after. All right, so this is very important because you don't want to miss this initial enrollment period or it could cost you big time. So when does my Medicare begin? Well, if your birthday is between the 2nd and 31st, your Medicare will go into effect on the first day of your birth month. You see the example here on the screen. If I was born April the 15th, my effective date would be April the 1st. However, if my birthday is on the 1st, then my Medicare will go into effect the 1st of the month prior to my birth month. Once again, you see the example here on the screen. If I'm born on April the 1st, my effective date would be March the 1st. Let's look at Medicare Part A, known as your hospital insurance. Some people even refer to it as your inpatient insurance. Most Medicare beneficiaries like yourself are going to be in this top bullet point you see here on the screen. There's going to be no premium associated with your Medicare Part A if you have met Medicare's requirements. Now, if you feel like you may fall into those other categories below, then that's something that we'll need to discuss by phone, by Zoom, or in person, so we can kind of dive into it and look at your specific situation. One other thing you might want to be made aware of is that there is a $1,676 deductible per benefit period associated with Medicare Part A, and you could be subject to that multiple times per year. This is why you want to have something in place to shield yourself against that. And we're going to talk about that just a little bit later on in the webinar. Now, Medicare Part B, known as your medical insurance, some people refer to it as your outpatient insurance, it does have a premium associated with it. Most people, 95 to 98% of the people, are going to pay the standard premium of $185 per month. And this will either come out of your Social Security if you're on Social Security when you go on Medicare, or you'll have to pay this quarterly if you are not. It also has a $257 annual deductible. That's up from $240 last year in 2024. And then Part B only pays 80% of the medical bills, which leaves you, the Medicare beneficiary, 20%. And that 20% is uncapped. This is why you want to have something in place to shield you against that 20%. And I'm going to talk about that just a little bit later in the webinar. Now, one thing I do want to bring up is what's known as an IRMA penalty. I like to call it an upcharge, where if you have made a significantly higher income 2 years prior to you going on Medicare, then you could wind up paying a higher Part B premium. So in other words, in 2025, Medicare is going to take your 2023 modified adjusted gross income, and they're going to use that to base whatever premium you will have to pay for Medicare Part B. Now, the good news is, in some instances, you can appeal that, and we can talk about that on Zoom, by phone, or in person, but most people are going to be in the 185 category. So let's talk about Medicare Part B. I briefly mentioned it. It's going to come out of my Social Security if I'm on Social Security when I go on Medicare, or I'm going to have to pay it quarterly. There's also some monthly options that you can go online there. You may want to take a screenshot of this screen, and you can go there and set that up for yourself on a monthly basis. One popular question that I get asked is, well, what if I want to stay on my group coverage, but I'm no longer going to be actively employed? Is that going to hurt me in any way with Medicare? And the answer is yes. Is that if you're no longer employed and you decide not to activate your Part B, even though you are on group health coverage, you will receive a Medicare Part B premium penalty, and that premium is 10% for each 12-month period that you were eligible for Part B. I run into people occasionally that never paid attention to this, and now they're 75 years old and they have this 10-year Medicare Part B premium penalty, and now they have to worry about paying that if they go on Medicare. So we definitely want to be made aware of this caveat here when it comes to going on Medicare. Now, a couple of things that we want to be made aware of, because I get asked this question very frequently. Well, should I stay on Medicare or should I stay on group coverage, especially if I'm going to stay working till 67, 68 years old? And the short answer is it really depends. Well, here are some main factors that we have to be concerned about. What am I currently paying now for my group coverage versus what am I going to pay premium-wise on Medicare? What is the deductibles? What about co-insurance, max out-of-pockets, co-payments? And here's one that I really think needs to play a big factor in your decision is your your prescription drugs, because I'm running into more and more people that are on higher tier drugs that sometimes their group coverage can pay a little bit better than what Medicare could pay. And these are all factors that need to go into our ultimate decision. Another common question I get is, well, my spouse is on my group coverage, so what am I going to do for them if I go on Medicare? If it's better for me to go on Medicare, where does that lead my spouse? Well, the good news is we have plenty of options for them. One of the most popular options is using the Affordable Care Act or Marketplace, because they take all pre-existing conditions. Some people like these Christian health sharing programs. There's some short-term medical plans out there. Then there's even some private or standalone Blue Cross plans that you could qualify for. The main thing is every option outside of the Affordable Care Act is going to require a form of underwriting. All right, so let's dive right into the two options that you have when it comes to going on Medicare. I'm going to talk about original Medicare first. That's your Part A, your Part B, with a standalone Medicare supplement plan or Medigap plan and a prescription drug plan. Now, one side note I'll make you aware of is if you go the original Medicare route, you not only will you need the Medicare Gap plan or the drug plan, but if you have other needs, like ancillary needs, like dental, vision, and some other things, Medicare does not cover those things, so you will have to get those separately. But for today's webinar, I'm going to talk about the two nuts and bolts here plans, and that is your Medicare supplement and your Part D. And later on in the video, I'll cover the Medicare Advantage plan, also known as a Part C plan. All right, one of the main pros of going on a supplement plan and staying on original Medicare is I can go to any doctor, any hospital, any provider that takes Medicare. I don't have to worry about networks, in other words, all right? And so this is one of the most popular reasons why people like the Medicare supplement plans. You see the 10 plans available on the screen here. The most popular one, the one that I'm going to deal with in today's webinar, is going to be the Plan G. And the Plan G covers everything except for that Medicare Part B deductible that I referenced a few minutes ago. And that deductible is $257 for 2025, and that is an annual deductible. The good news is it shields me against that $1,676 deductible per benefit period. It also shields me against that 20% that's left over. Remember, there's no limit on that, so I'm shielded against that, and my Medigap plan is going to cover that. And then it's also going to cover me against what's known excess charges. And excess charges are just simply this, that Medicare has an approved billing rate, but it gives the provider up to 15% over that rate to bill you, the Medicare beneficiary. If you are on a Plan G, that is going to cover that for you. Monthly premiums are really going to depend on what part of the country that you live in, your zip code, so to speak. And I've seen them as low as $100, and I've seen them as high as $150. But here's the good news about a Medicare supplement Plan G. It's the same with Company A as it is with Company B. Why do I bring that up in this webinar today? Because it doesn't matter which company you go with, they all have to pay the same. They're all the best, if you will, because Medicare standardizes these plans. And so it's very important that you work with a Medicare, what I call broker/advisor, who works with multiple carriers, if not all the carriers in your area. So that way you're getting the best possible situation on the premium side of things. All right, now let's take a look at Medicare Part D. Whenever we sit down with someone by Zoom, over phone, or in person, we always ask for a complete list of their medications and the name of their pharmacy, because the pharmacy that you use on Medicare makes a difference. We also want to make sure that all of your medicines are in the plan's formularies. And just like in the beginning, when I talked about that initial enrollment period, we definitely want to make sure that we meet that as well with your Part D plan. So that way you don't have any penalties that will follow you for the life, your Medicare journey life. And then the other thing is there's an annual open enrollment period that happens from October the 15th through December the 7th. Medicare opens up this window for you, the Medicare beneficiary, to reshop and review your plan. So I believe this is very, very important, because not getting on the right drug plan could cost you hundreds, even thousands of dollars every single year. I've already talked about the annual enrollment period that you see here. Why is it important? Why do I stress this? Because you need to do this every single year. You don't need to adopt a mindset of, well, my drug plan's been working for me, so if it's not broken, I'm not going to try to fix it. You do not want to do that when it comes to a Medicare drug plan, because these are one-year agreements, and the tiers of drugs can change. They could take your drug completely out of the formulary for the following year. So you definitely want to make sure that you review these every single year. Now, for 2025, some of the big changes due to the Inflation Reduction Act is, number one, is they have implemented a $2,000 max out of pocket. That's good news for you, the Medicare beneficiary, especially if you are taking multiple high-tier drugs. Now, to give you some context, last year, the maximum out of pocket was $8,000. So that's a huge burden off of you, the Medicare beneficiaries' shoulders. Also, they removed the donut hole. This is something that has been plaguing Medicare beneficiaries for years. Also, the proper name was the coverage gap, but most people know it as the donut hole. So that's good news for you. So that way you don't have to pay 25% of the retail cost of the drugs. They've also implemented a Medicare prescription payment plan where you can spread out the cost of your higher tier drugs over a year span. And then the annual deductible was raised from $545 in 2024 to $590 in 2025. Here's some examples of some low and high tier drugs. Why do I show this today? And the webinar is because if you're on lower tier drugs, they're not going to trigger that $590 deductible. But if you're on some of the higher tier drugs, in most cases, it is going to trigger that deductible. So this is why we want to look at this when you first go on Medicare. So that way you're aware of, hey, maybe I need to get off of one of these higher tier drugs, name brand drugs, and get on a generic drug. All right, just like with Medicare Part B, I had an IRMA penalty, or I could incur a IRMA penalty, I should say. It's the same thing with your Part D. If I fall into one of these higher income categories, I could be assessed this penalty, and they're going to use your 2023 modified adjusted gross income to determine what that premium is. Now, here's the good news. Most people are going to be in that top category, but if you do feel like you can fall into one of those other categories, this is something that we definitely want to discuss when we meet with you to make sure you're well aware of what's going on. Then also that you're well aware of your the possibility or your options to be able to appeal that as well. All right, one real quickly, the Part D late enrollment penalty. If we do not enroll on a drug plan or in a drug plan when we first go on Medicare and we miss that open enrollment window, we could incur a late penalty, and that penalty follows us for the rest of our lives unless we qualify for Medicaid. I can't tell you how many people that I talk to across the country that this has happened to, because when they went on Medicare for the first time, they were not taking any drugs, or they were hardly taking any drugs that cost anything at all. And they just said, you know what, I don't want to pay an extra premium, so I'm just going to get the Medigap plan, but I'm not going to get the drug plan. That is not good for you, the Medicare beneficiary, because of the fact that you will incur a penalty that you cannot get rid of unless you qualify for Medicaid. So let's dive right in to the second option that we have. We talked about original Medicare with the supplement with the drug plan. Now we're going to talk about a Medicare Advantage plan, also known as a Part C plan. And what a Part C plan does, it combines your Part A and Part B. It takes your prescription drug coverage. Most plans are going to have dental, vision, hearing, over-the-counter cards, gym memberships, and more included in it. And these are these real, these popular commercials you see on TV where they're running them all the time with these celebrities talking about these type of plans. And they can be great plans, but there are some nuances that you need to be made aware of. These are plans that are ran by private insurance companies approved by and under the contract with Medicare. Here's things that you need to be made aware of. Number one is you're going to have co-insurance. You're going to have co-payments built into all the program. You're going to have a max out-of-pocket that you're going to have to deal with. But the main thing is the two most popular Medicare Advantage plans are HMOs and PPOs. And an HMO is a very restrictive plan, which states I can only go in that plan's network, or I'll either be denied service or pay full price unless it's deemed as a medical emergency. The PPO plan gives me a little bit more flexibility. It allows me to go in and out of the network, but if I go out of the network, then I just pay a little bit more for those medical costs. Another thing that you need to be made aware of is I get asked this question pretty frequently is, well, if these Medicare Advantage plans are zero premium in my area, do I still have to pay my Medicare Part B premium? And the answer is yes. The only way that you can get out of paying that Medicare Part B premium is if you qualify for Medicaid. And then one more thing that I'll make you aware of here is there is an open enrollment, just like Part D had an open enrollment that you can take part in every single year. You'll definitely want to do the same thing with your Medicare Advantage plan, and that is from October the 15th through December the 7th. So who can join a Medicare Advantage plan? Well, you must have Medicare Parts A and B and live in the plan's service area to be eligible to join. There's no health questions. Once again, they're typically zero premium in most zip codes, but you definitely want to check all of your medicines, and you definitely want to make sure that all of your doctors, hospitals, and providers are in this specific plan's network. We do not recommend that you get a Medicare Advantage plan by itself. We like to combine it with what's known as a hospital indemnity plan, a GAP plan, a hospital reimbursement plan. Bottom line is it helps shield you against some of these copays that you're left with when you enroll on one of these plans. So even though there's zero premium, there are some copays that you need to be made aware of. Daily inpatient hospital copays, outpatient surgery copays, ER visit copays, ambulance ride copays, skilled nursing copays, and more. These are things that you need to be made aware of, but your GAP plan can help shield you against some of these bigger copays and provide you better coverage, which would ultimately give you better peace of mind. If you're on Medicare or Medicaid today, that is a totally different webinar and conversation that you'll just need to reach out to us or schedule something on the calendar, and we can take a deeper dive into that. But there are special plans for you if you're on Medicare and Medicaid, and generally those plans are zero. So you don't have any cost associated with them. But what they're going to do is give you extra ancillary benefits that you do not get with Medicare and Medicaid. And this is dental, vision, grocery cards, and more. Once again, this is a discussion that we can take a deeper dive into once we meet either by Zoom, in person, or over the phone. If you're a veteran watching this today, there are special zero premium plans for you as well, because what we find is most veterans are using the VA for everything. However, the biggest benefit that you can get from going on one of these zero specialized veteran plans is you can get a lot of that Part B premium back. Remember, it was $185 in these programs, which the good news is it won't interfere with any of your veteran benefits, but you can get a lot of that Part B premium back. So that may be worth just the benefit for you alone. If you're a veteran today, we encourage you to reach out to us, schedule a time, and we can take a deeper dive into that as well. So let's take a 30,000 foot view, if you will, a high level view of the differences between Medicare supplement, if I stay on original Medicare, versus if I go on an Advantage plan. With the Medicare supplement plan, I have higher premiums, but no copays or co-insurance payments. On the Medicare Advantage side, generally zero or lower premiums. I do got to be concerned about copays, co-insurance, and max out-of-pockets. On the original Medicare side, with the Medigap, I have the freedom to choose the doctors and hospitals. So that's the biggest pro for many of those that choose this route, where on the Medicare Advantage side, I got to be concerned about HMOs and PPOs and make sure that all of my doctors are in those networks. On the Medicare supplement side, no referrals necessary. On the Medicare Advantage side, referrals for specialists are rarely required. If there was a negative on the Medicare supplement side, it doesn't come with any ancillary benefits. So if you have group benefits now at work and you're going on Medicare and you have dental, vision, all of that, you will have to get separate plans to meet those needs. Where on the Medicare Advantage side, most plans are going to have all of that included in those plans, and then covered out on the Medicare supplement side, covered anywhere in the U.S., limited services outside of the U.S. On the Medicare Advantage side, emergency services covered worldwide. So why choose Agape as we get ready to close today? Well, because we're independent agents that work in most states and work with many, many carriers. And so that's good news for you, because our loyalty is not to a specific carrier. It's to you that are watching this today to make sure that you get the best possible situation premium-wise and the most bang for your buck, if you will. All right. So this is why we believe it's important to choose independent agents like us at Agape. We have over 20 years of experience. And once again, it doesn't cost you anything extra to use a seasoned Medicare advisor like myself. And so we would love the opportunity to work with you. Now, I told you at the very beginning, there are 3 Medicare bonuses that I want to give you today. So as we close, I'm going to show you how you can get these. Number 1 is I want you to click on the gold phone on the screen, and I want you to set up a date on the calendar where you and I can either meet by Zoom or by phone, or if you live locally in our region, we'd be more than happy for you to swing by our office. This is at zero cost, no obligation to you. I just want to sit down with you and really give you a personalized Medicare review. We work in most states, but if I do not work in your state, I have a trusted network of seasoned Medicare advisors that I can refer you to. So bonus number 1 is I'm going to give you a Medicare roadmap, just like you see here on the screen, to make sure you understand how this journey goes as you get ready to turn 65. This is going to make it easier for you, eliminate a lot of the confusion, and bring some clarity. So that's bonus number 1. Bonus number 2 is I'm going to give you a personalized Medicare cost summary. Can't do that without your zip code and some other information that I need to make this personalized for you. So that way you have it in writing. You know what it's going to cost you to go on Medicare, and it's going to allow you to compare, especially if you're going to stay on group coverage, or there's a possibility you may stay on group coverage and you're working. This will allow you to compare apples to apples and oranges to oranges. And these are Medicare specifics. There's no one size fits all. Everybody's situation is different. And then finally, bonus number 3 is I run into people all the time that watch my webinars or come and see one of my live educational seminars in person. They don't know what to do for retirement. They don't know what to do with their 401ks or their pension plans, or maybe they have some investments over here, or they don't know if they should stay in the stock market, etc. Well, we are going to give you a comprehensive and complimentary personalized retirement review to make sure that you're on track for retirement. This is all at no cost to you. So I want you to be able to take advantage of these Medicare bonuses, because they're going to allow you to have peace of mind and bring tons of clarity. You may want to take a screenshot of this here on the screen. This is my wife's information, our office number, our address. You're more than welcome to go on the internet and check us out on our website. And we're very proud that we have tons of 5-star reviews from other people that we've worked with all across the country, just like you. And we would love the opportunity to work with you as well. So please click on the gold phone. It's going to open up my calendar, set a date and a time, and then we will meet and we will help make sure that you get this right the first time. God bless. Thanks for watching, and make it an awesome day.